China, COVID infections soaring.
Lockdowns, quarantines, business shutdowns.
WHO is very concerned over the evolving situation in China.
Suspected case of COVID-19.
Malaysia has gone into a strict nationwide
nation
lockdown.
drive on Wednesday with its
the first death. Officials in
COVID-19.
3 deaths.
10 new patients.
Measures in the world.
Are non-nationals. They are of Wuhan, China.
COVID-19, or known as coronavirus disease, is an infectious disease caused by the SARS-CoV-2 virus, which is exactly severe acute respiratory syndrome coronavirus 2. A novel coronavirus was first found and identified in Wuhan, China in 31 December 2019, where the World Health Organization (WHO) has informed that there was a cases of pneumonia that was detected if the cause is unknown. This scenario can be seen where the SARS-CoV-2 virus was originally suspected have transferred to humans at one of Wuhan at China's outdoor wet market. People who had no direct touch with animals became infected when COVID-19 spread both inside and outside of China. That indicates that a human being can spread the infection to another. People are unintentionally contracting and spreading the coronavirus as a result of its continuous spread to the United States and throughout the world. COVID-19 has been classified as a high-risk airborne infectious disease that may cause significant respiratory infections, such as flu, cold, and pneumonia. In addition, it was very violent and quickly spread among people globally. The report of daily cases has been updated through the WHO Situation Reports dashboard. The word corona means crown and may refer to the appearance of the coronavirus acquired due to the spike protein that emerged from them. The component of the virus known as the spike protein is part that binds to a human cell to cause infection, allowing the virus to multiply inside the cell and spread to other cells. Coronavirus is an envelope positive sense of RNA viruses which are classified by cloud-like spikes that project from the surface, an unusual large RNA genome, and a special application technique. The coronavirus family includes pathogens from numerous animal species as well as humans, including the recently isolated severe acute respiratory syndrome coronavirus known as SARS-CoV. The spreading of COVID-19 virus could be spread through the droplets that would be released when the person breathes, cough, sneeze, or speak. In addition, the virus is known as a variation when it undergoes one or more of these mutations. These are numerous well-known varieties have emerged since the pandemic starts, including Alpha, Beta, Delta, and Omicron. The COVID-19 variations that have undergone genetic changes that depart from the original COVID-19 sequence should not be referred to as virus strains, as they are essentially a different version of the virus.
SARS-CoV-2 attaches to the host target cell receptor, which is angiotensin-converting enzyme 2, or known as ACE2. ACE2 is an enzyme found in the membrane of cells in the intestines, kidney, or heart. The release of the virus and active replication in the lung cells cause non-specific symptoms such as fever, headache, and respiratory symptoms. The virus causes transient damage to cells in the olfactory epithelium in an experimental hamster model, resulting in olfactory dysfunction, which may explain the temporary loss of taste and smell that is commonly seen in COVID-19. Moreover, the location of infections and patient symptoms may be explained by the distribution of ACE2 receptors in various tissues. The ACE2 receptor, for instance, is present in the epithelium of various organs, including the intestines, as well as endothelial cells in the kidney and blood vessels, which may explain gastrointestinal symptoms and cardiovascular complications. These findings show that the virus directly affects many organs and much remains unknown. There is no cure yet for this virus, but vaccines help lower the risk of infection.
The SARS-CoV-2 virus, which is pathogenic and highly contagious, has caused bioaerosols and caused the outbreak. Therefore, it affects the human health, emotion, the education system, and socioeconomics. The virus impacts the human health by causing respiratory or cardiovascular complications. Even worse, infected diabetic patients and cardiac disease patients are at risk of developing severe pneumonia. In addition, coronavirus has also impacted the human reproduction system, in particular the behavior of male and female gametes. Then, this rapid spread has resulted in a high rate of death. In curbing this issue, the government has taken the action of curfew and confinement. However, this situation impacts the public's mental health negatively by showing symptoms of distress, depression, post-traumatic stress disorder, anxiety, frustration, and suicide. Moreover, this action also forces university and schools to be closed and all learning process need to be done online. Despite the benefits of online learning, some students are still affected by being left behind in their lessons due to the incapability of gaining access to online education solutions, technophobia, and poor internet connectivity. Furthermore, this action also results in the country's borders being closed, in which tourists are prohibited from visiting other countries. If tourism happens, tourists have to undergo quarantine and activities are restricted. Thus, this imposed social isolation impacted the economy by weakening industrial deliverability, the fall in demand from abroad, the dismissal of people, and the reduction in the human budget. In conclusion, the outbreak of COVID-19 disease has impacted humans in many aspects, including health, emotion, the education system, and socio-economics.
The government of Malaysia imposed the Movement Control Order MCO on the 18th March 2020. Following the imposition of the MCO, all Malaysians were largely instructed to remain indoors. Other restrictions imposed included a ban on large gatherings, health screening and quarantine for Malaysians returning from abroad, a ban on foreigners entering the country, and the closure of all facilities except primary and essential services such as healthcare, water, electricity, telecommunications, and food supply companies. The government implementation of the MCO in restricting mass movement was aiming to achieve two objectives: slowing the transmission chain in the community and allowing the Ministry of Health to trace, isolate, and manage the identified positive cases. The National COVID-19 Immunization Program is a massive nationwide to immunize the population in Malaysia against the COVID-19 disease. The three types of vaccine given were Pfizer, AstraZeneca, and Sinovac. The program was done in three phases for different target groups. Phase 1 involved an estimated 500,000 frontliners. Phase 2 involved the remainder frontliners, senior citizens, high-risk group with chronic disease, and people with disabilities. Phase 3 involved the remainders of population aged 18 years and above, with priority given to those in red zones. Another important move taken to combat the spread of COVID-19 was to increase the number of hospitals capable of treating COVID-19 cases. There was also a collaborative effort between public and private institutions, including university hospitals and Ministry of Defence hospitals, to accommodate the increased number of cases of infections.
Despite all facts that have been mentioned before, there are another 4 interesting facts related to COVID-19 disease. Firstly, instead of the common symptom of COVID-19, infected patients also may exhibit digestive symptoms such as vomiting, diarrhea, and abdominal pain. Studies have shown that some patients do not even exhibit common symptoms of COVID-19, but only digestive symptoms. Then, studies have shown that people with type A blood may be more susceptible to COVID-19 infection. In contrast, there are fewer infected people with type O blood. Moreover, did you know that the FDA has approved Remdesivir, Veklury, which is an antiviral drug to treat high-risk COVID-19 patients? However, it is difficult to get and requires special equipment to administer. Fortunately, this pill has been shown to improve symptoms and shorten the recovery period. Lastly, did you also know that vaccination is very effective in preventing severe COVID-19 symptoms? It is important to note that vaccination does not prevent us from being infected, but it prevents us from getting severe infections. Therefore, do not forget to take your vaccine and boosters to maintain a high level of protection against variants.